Very good morning, students. Welcome for day 2 of foundation course. This is why we conduct foundation course, because from chemistry lab and physics laboratory you are directly coming to dissection hall in anatomy department. So we need some transition, and there is a different learning environment also. You are away from home, so you have to acclimatize for the campus environment. That is number one. And then you should be made familiar about the teaching programs, and we should help you to adapt to academic challenges. So this is why the foundation course was devised by MCI and NMC. Now this was the old schedule, but because of COVID, the entire schedule is disturbed, and now we can see for your batch, instead of August, your batch will start from the month of February, and your university examination will be scheduled in the month of January 2022. But our college is proactive. Since you are taken admission and you are at home, we thought it is necessary to utilize your time fruitfully. That is why we have started online foundation course. In this 1 year time, you will have 2 internal assessment examinations and 1 prelim exam. Now this is how, this slide, this is how the duration of 175 hours is distributed. 30 hours for orientation, 35 hours for skill module, 8 hours for field visits to community health centers, professional development and outcome module 40 hours, sports and extracurricular 22 hours, language and computer skills 50 hours. Now these are some of the glimpses of the foundation course which was conducted in classroom last time. There was no COVID. Some of the activities related to foundation course, cultural events, which you have seen in yesterday's beautiful video by Paur and Isha. Now these are some of the unique or salient features of medical education in rural medical college. We have got a community-oriented medical education. Student research projects is very important part. We involve the students in NSS and Unnat Bharat Abhiyan. We have problem-based learning. We involve students in public health days like World Health Day, World TB Day, World AIDS Day, etc. And we have integrated teaching seminars. Your batches allotted 5 families in first MBBS. When you are posted in community medicine, you maintain a journal, and follow-up of those families is kept in further second year and third year. These are some of the photographs of family study. So this makes our medical education in Paura different from other places. You students learn social anatomy, social physiology. These are the villages selected for last 10 years. And student research project. From second MBBS, we have made it compulsory that a group of students, 4 to 5 students, will be given a research project under guidance of faculty. And the students are made to present the research project in a hall where all staff and students are invited. And there is a question and answer session. The NSS scheme, National Service Scheme, again is very important. This is under Ministry of Youth and Sports, Government of India. And we are running this for last 4 years. We also have a residential 10 days camp in a village under this scheme. Blood donation camp, you can see the photographs, nutrition exhibition, hand washing, It is a hand washing day celebrated by NSS students. This is one more scheme of Government of India, Unnat Bharat Abhiyan, where we involve our students. So basically, rainwater harvesting, vermicomposting, these are the thrust areas. And under this scheme, our students also did COVID-19 survey in 5 adopted villages. Some of the photographs. Students are involved to generate health awareness in community, allotted families. We conduct quiz for the students. Photograph showing involvement in public health days. Students perform role play, street play, the elocution competition, rangoli competition, poster competition. Some of our videos are on YouTube. And problem-based learning is one of the small group teaching approach where your batch is divided in 8 to 10. There is a facilitator, and this is a pattern of teaching learning where students are active. Teacher does not teach you, a scenario is given and students discuss the scenario, they formulate learning needs, come prepared next time and discuss the scenario. So student, this is active learning. This was an integrated seminar on leprosy. One whole day was dedicated on the topic of leprosy. After initial PowerPoint presentations by teachers, 30 disabled leprosy patients were brought out on the stage and students were allowed to palpate the nerves, take the sensations. So they got a unique opportunity. Nowadays we don't see a leprosy case in the hospital. Some other activities by the students. These are our health centers. Now I stop here and I welcome the first speaker of today, Dr. Sandeep Pakle. He is Professor and Head Department of Anatomy. He has completed advanced course in medical education from the Dept Institute, Savangi. He is active member of our medical education unit and is also looking after IQAC of University. He is IQAC coordinator of PIMS University. So over to Dr. Sandeep Pakle.
Good morning, students. On behalf of Department of Anatomy, Rural Medical College, Pravara Institute of Medical Sciences deemed to be university, I congratulate you for getting admission in the prestigious institutes, Pravara Institute of Medical Sciences. Today, I am going to introduce you the subject of anatomy, that is introduction to the anatomy. Slide. The induction to anatomy for first MBBS. So objectives of my session, that is first MBBS 2020 batch students will be able to define competency based medical education, know the Department of Anatomy, its orientation. You should able to tell about what are the teaching hours and different sections of the anatomy and how is the assessment and evaluation pattern in the subject of anatomy. Before going to details of the anatomy subject, you should know what is competency based medical education, which already started from the 2019 batch. The CBME or competency based medical education is a model which is centered on the student and focused on mastery of the competencies based on learning outcomes. What is different from the traditional teaching methodology which were used before 2019? The few of the important aspects of this CBME which already you know now that is foundation course, which were not previously in the traditional method of teaching. Then few stressed points are early clinical exposure, integrated teaching and learning, skill development and training, and the electives, which is the high point of the CBME course. In detail, all these things we are going to study as the foundation course goes. Now, what is a competency? It is an observable ability of a health professional integrating multiple components like knowledge, skills, attitudes, and values. What should you be able to do, or what should have changed in knowledge, skill, attitude, and communication, which the competency provide first aid to the trauma victim, which emphasize on the Indian medical graduate as a physician of first contact of the community while being globally relevant. So previously Medical Council of India and now National Medical Commission has stressed upon what are the components of the Indian medical graduate. It is CBME is a outcome-based approach to the design, implementation, assessment and evaluation of medical education program using an organized framework of the competencies. The silent features of a Graduate Medical Education Regulation 2019, which is changed after about 20 years from 1997, and it is amended on the 4th November 2019 in the Gazette of India as amendment notification. The Indian medical graduate program is designed with a goal to create an Indian medical graduate possessing requisite knowledge, skill, attitude, values and responsiveness so that he or she may function appropriately and effectively as a physician of first contact of the community while being globally relevant. The goal of Medical Council of India, previously now National Medical Commission, the undergraduate medical education, is to create the Indian medical graduate with all the requisite knowledge, skill, attitude, values, responsiveness, so that he or she may function appropriately and effective as a doctor of first contact of the community while being globally relevant. Now, to achieve this goal, or in order to fulfill a goal, the Indian medical graduate has different role as a person, department and institution. And these roles of the Indian medical graduate are: he should be a good clinician, leader and team member, communicator, lifelong learner and professional. The student-doctor method of learning should be there so that we can achieve all these roles of a IMG. One important point in the CBME is skill acquisition, which was previously also there, but it is stressed by adding the skills lab, through which we can learn different skills which are required by IMG on first mannequins and then under observation, and then they can perform on a patient. As I told you, the early clinical exposure is also an important point which is stressed in CBME, which gives, you all know that during first year there are 3 basic science subjects: anatomy, physiology and biochemistry, and these basic science subjects should be correlated with the paraclinical and clinical subjects, and for that we should have exposure to those subjects. And during first year, whenever required, few of the topics are correlated by giving early clinical exposure. Another important point of CBME is AdCom, which you will study in detail. Few of the modules are you have to acquire in the first phase in different subjects. Out of that, anatomy has 2 modules that we will see in detail later on. Then, in addition to the early clinical exposure and AdCom, few additional point is self-directed learning, wherein you have to study in a specific manner on your own, giving or having some objectives which are predefined and which should be evaluated after that SDL session or the self-directed learning. This elective part is not of phase 1, but it is an brief course made available to the learner during undergraduate study period after the third phase, third minor, where you can choose from the available options depending upon their interest and career preferences. And now if you come to the assessment is of 2 types, formative and summative. And these 2 assessments, as far as anatomy is concerned, in the formative assessment is day-to-day assessment during your learning period, and the summative assessment is which is at the end of learning process, which mainly done by the university examination. Details of both these we will see. Now coming to the history of Department of Anatomy, our department has a long history which is established along with this Rural Medical College in 1984 with the various ideas from stalwarts of anatomy which you can see in these photographs. As the department evolves, there are different courses added in the department along with the MBBS. The vision of the department is to achieve the excellence in teaching anatomy, and the mission is to lay a strong foundation for medical education with emphasis on clinically relevant course material so as to address a crucial need for patient care and medical research in basic sciences. Now these are the faculties which are present in the Department of Anatomy. When you will come here, we will introduce them with you. This is the floor map of the Department of Anatomy, where the Department of Anatomy is located in the Rural Medical College old building, wherein you can see here the dissection hall. These are the departments. Here there are 3 lecture halls: red hall, grey hall, blue hall. Out of that, red hall is for the theory lectures. There are demonstration rooms. In the demonstration room, you may come for the small group teaching like osteology section and few of the demonstrations. The facilities which are present in the department are, we have trinocular microscope with high definition video camera which is projected on a projector for the histology part. You can see on the projector through this microscope and projection system the histology slides. Histology is a part of the anatomy where we study the tissues under the microscope. Then most important part of the anatomy is dissection, and this dissection hall contains dedicated projection system which you can see in this picture, where a demonstration of the dissection of the said topic is shown on the projection, and you have to follow on the different cadavers which will be provided to you. This is a red hall which you can see the sitting arrangement, but probably due to COVID we have to see the alternate method to keep the distance. This is a dissection hall and the projection system where you can see whatever dissected part can be seen on a projector, and then on your own dissection table you can do the dissection. This is a histology lab wherein you have to study the histology slides. So each student will get a set of microscopic slides which you have to mount on the microscope and see under the microscope. So this is done during the histology practical hall. We have also a beautiful museum which is arranged region wise. Different regions are arranged in different racks. There is an embryology section, radiology section, and we have charts to describe the each model or the wet specimen which is present in the museum. Whenever you get time, you can go to the museum and study different regions, wet specimens and embryology models in the museum. We have also the osteology section in the museum and the separate embryology section. You can see the slide projection system like this on the projector or through the microscope. We will see in detail later about these parts. Now coming to the time distribution of the MBBS program, I think already we have discussed. There is a 13-month period for the first phase, which includes first year exam after the foundation course. The foundation course hours already sir has discussed. Now we'll straightway go to the first professional, which includes the anatomy, physiology, biochemistry and introduction to community medicine. Total duration is about 13 months. The second professional is 12 months, third professional part 1 is 13 months, 2 months electives, and third professional part 2 is 13 months. So this time frame already now you know. Now first professional teaching hours, if you see, for anatomy we will concentrate on anatomy only. There are about 220 teaching lecture hours. Then small group teaching, which includes demonstration, tutorial, seminar, practical and dissection, is about 415 hours, and 40 hours of the self-directed learning and about 8 hours of the attitude, ethics and communication, that is ATCOM. So for anatomy there are total about 675 hours. So as competency based medical education, we have to understand and study and achieve the anatomic competencies. There are about 82 competencies and the topics which will be studied during the phase 1 in human anatomy. And in these 82 topics we have to learn the outcomes about 409, so which is given in the part first of the curriculum. The other topics and the outcomes you will study during their respective subjects. We will not go into the detail. So as far as anatomy is concerned, you can see the number is given like AN11, which means anatomy 1 subtopic 1. The topic is anatomical terminology. The number of competencies are 2 and the number of procedure for certification, they are given separately. So if you see here, the domain which you should know, that is knowledge, skill, attitude, communication, out of that which component that topic is covering, the level up to which level you should know, what is the teaching learning method and what is the assessment method is given in that competency curriculum volume 1 part. So you can go through that and you can have a marking in your book which competencies you have to achieve and what is the assessment method. Now coming to the marks distribution of various subjects, out of that we will concentrate here only on anatomy. The human anatomy has 2 papers in the first professional, total 200 marks, and practical is of 100 mark. So that is about the university examination. Then what about internal assessment examination? In detail we will see. The internal assessment and university examinations, as far as CBME MBBS batch is concerned, there are about 2 term examination, term 1, term 2 and 1 preliminary examination. So 3 examinations are there which include both theory and practical. The theory for the first internal assessment examination and second internal assessment examination is of 100 marks and the practical is of 50 mark. The theory part includes different types of questions, for example multiple choice questions, short answer questions, long answer questions, and the practical part includes different parts like soft part, which means muscles, organs, like that, then microanatomy, that is histology slides for identification and for discussion, then hard part which means bones, then embryology models, then clinical anatomy including genetic charts. We have a journal or record book and logbook where you have to enter the reflections of the activities conducted during the teaching in the logbook, like early clinical exposure, self-directed learning, and whatever practical you are learning, that you have to draw in the journal, and it carries 5 mark during the internal assessment examination. The radiology part has 5 marks and the living anatomy is also 5 marks. Total 50 marks are there for internal assessment 1 and 2. Then for preliminary examination we have soft part 25 marks, microanatomy 10 marks, microanatomy slide discussion 2 slides 5 marks, axial skeleton 10 mark, embryology model 10 mark, clinical anatomy 2 spots or 2 charts for 10 mark, again journal logbook 10 mark. So total is 80 for the practical, and appendicular skeleton, x-ray, surface living anatomy, this 20. So total 100 marks are there for the prelim. So preliminary examination is similar to the university examination. Now coming to the university examination, the soft part carries 30 mark, microanatomy or the histology carries 10 mark, slide discussions, there are 2 slides of 10 mark, axial skeleton for 10 mark, embryology model for 10 mark, clinical anatomy including genetics for 10 mark, and appendicular skeleton 10 mark, radiology 5 mark, surface living 5 mark. So total of the 100 marks is university practical examination. Now if you go to the pattern of theory examination paper, there are two papers, paper 1 and paper 2, which are of 100 marks each. There are two sections, section A and section B. Section A is of multiple choice question. Each question carry 1 mark, and there are about 20 MCQs. Out of that, 4 MCQs should be case based. The section B carries 80 marks. In that, question 2 is of short answer question. You have to attempt 4 out of 5 questions. Out of these 5, 2 SAQs will be clinical application based. So 4 into 5, that is 20 mark. Then question 3 is of structured long answer question. Any 2 out of 3, which is about 10 marks each, and total is 20 marks. The question 4 is again short answer question, 4 out of 5. Here the one SAQ should be on ATCOM module. The question 5 is structured long answer question, again 2 out of 3, 10 marks each, 20 marks. So total 100 mark theory paper. The distribution of topics from paper 1 and paper 2 is like this. Paper 1 contains superior extremity, general embryology, genetics, gross anatomy of head, neck, face, gross anatomy related to central nervous system, one short answer question on ATCOM module, related histology and embryology, and scenario or application based questions from any topic of the above, that is superior extremity, head, neck, face. The paper 2 contains general anatomy, general histology, related histology and embryology of the abdomen, pelvis, inferior extremity and thorax, and also the gross anatomy of the abdomen, pelvis, inferior extremity and thorax. Each paper contains about 1 or 2 questions on scenario based or application based questions in the SAQ as well as LAQs. So this is about the distribution of topic in paper 1 and paper 2. Now coming to the internal assessment calculation, if we see the first exam, theory 100 mark, practical 50 mark, total 150 mark. Second exam, theory again 100 mark, practical 50 mark and total 150 mark. And preliminary is of 200 theory, 100 practical, total 300 mark. So convergent formula for the calculation of internal assessment examination: theory is different, practical is different. So total theory comes 400, which is divided by 10, which comes 16 minimum for the eligibility to appear out of the 40. Then for practical again 51st, 52nd, 100 preliminary examination, so total 200, which is divided by 5. So minimum 16 should be there to eligible for the university examination, and total addition of theory and practical should be more than 40. So total theory plus practical must be more than 40. So 40 marks, that is 50%. So that is how you have to score in the internal assessment examination. There is a separate passing for internal assessment, then there is separate passing for the university theory and university practical examination. So that is about the introduction to anatomy, question paper pattern and the internal assessment pattern of the anatomy subject. So whenever you come in the campus, again we will go through the department and the various parts of the anatomy. Thank you so much. Now I request Dr. N.B. Kulkarni sir, Professor and Head Department of Physiology, to introduce you in the subject of Physiology.
Good morning, students. Welcome to the Rural Medical College, Loni. I am Dr. Kulkarni and I will be giving you some information regarding the Department of Physiology. So, welcome to the Physiology Department. Now you are all aware by this time that in the first professional year, that is in the first MBBS, there are 4 subjects: anatomy, physiology, biochemistry and community medicine, which will continue into the second MBBS. Now a general overview of the department. It is situated on the 4th floor in the new college building. It conducts extensive academic programs. नाही, हे द्या ना मला. हां, ओके. आता पहिल्या वेळेस ना So good morning, students. There are some technical snag because of which we had to stop the continuation, and again we'll repeat this. So I'm the Professor and Head of Physiology Department, Rural Medical College. So in the first professional year, there are 4 subjects, you know by this time. One is anatomy, second is physiology, third is biochemistry, and fourth is community medicine, which will continue into the second MBBS. Now let us get a general idea about the physiology department. The department is situated on the 4th floor in the new college building. It conducts extensive academic program as per CBME suggestions, that is the competency based medical education as suggested by the National Medical Commission for first year MBBS students and also allied branches. The department offers MD Physiology, MSc Medical Physiology and PhD in Physiology courses with extensive academic activity. There are spacious and well equipped laboratories for UG teaching as well as for PG teaching. Also we have the latest teaching aids like the LCDs, the projectors and the latest sound system also. The department also has CDs on various topics and they are shown to the students regularly as a part of syllabus. Then we conduct student seminars as well as integrated teaching sessions. The student seminars are the seminars or the teaching activity in which the students participate themselves. So initially we call for the volunteers, those who want to volunteer for the student seminar, and then we select 4 to 5 students, and then we give a small topic to each one of them, and then they will present that topic as if they are teaching the other students on that particular topic, and then we give them marks and also we declare the winner. Apart from that, we have integrated teaching sessions where the physiology department integrates horizontally with the anatomy and the biochemistry department, and also second year departments like the pathology or medicine depending upon the topic. The teaching is updated with latest development in the subject and its correlation with the clinical aspects, because all that we do or all that we teach in physiology is the basis of what they are going to see later on in their clinical teaching. Then we have a highly motivated, qualified, experienced staff. We also have a mentorship program, of course, which will be carried on by other departments also. Where mentorship program consists of a teacher and a certain group of students. About 10 students are allotted to one teacher, and then there will be frequent meetings or discussions between the teachers and the students communicate their problems to the mentor, and the mentor then tries to resolve them. Then the department, we have a departmental library with latest edition of textbooks and also the reference books. Then the highlights of undergraduate teaching. Now during an academic year, various teaching learning methods are used, like the lectures, practicals, tutorials, lecture cum demonstrations, group discussions, self-directed learning, and quiz programs are arranged for the students. The physiology department or the physiology subject as such has about 160 lectures based on different systems, and the small group teachings we have about 310 hours. The small group teaching methods such as interactive tutorial sessions, computer aided teaching, problem based learning, of course, which is being conducted by all the departments. These sessions are used for better understanding by the students. This also helps in providing personal attention to the students. Then we have visit to blood bank. The students are taken to the blood bank and they are shown the process of blood banking. How is the blood collected? How is it stored? How the blood group is determined, and so on. We also take the students to hospital wards and various departments, clinical departments, during which they will know or they will get to know the ambience of the hospital and the teachers working in the clinical department. Then the students are also introduced to rural community health through the community medicine department. The physiology subject itself is simplified while teaching by using various charts and models that are available in the department. We have also prepared a question bank as per the syllabus, and questions are prepared in accordance with the pattern of the university examination. Then we have special coaching classes for repeaters and slow learners. After one or two initial examinations, we find out those students who have got little less marks, whom we can call them little slow learners, and we also find out those students who have got good marks and we call them fast learners. We have a different program for fast learners and we have a different program for slow learners, so that they can be taught in small groups and there can be exchange of knowledge between the teacher and the student. The infrastructure of the department. The physiology department has 4 laboratories. One is the hematology lab. This lab is situated on the 5th floor, and in this lab we do experiments on blood, like the total WBC count, where we count the number of WBCs per cubic millimeter of blood, differential WBC count, where we find the number of different types of WBC, what we call as the differential count. Then the students also do RBC count. They can do the hemoglobin estimation, they can find out the blood group, they can find out the bleeding time, clotting time, and so on. Then we have clinical lab. The clinical lab is situated on the 4th floor, and here we teach the students about the clinical examination. Now, a clinical examination is a bedside examination, and in this process, one of the subjects is made available to the students, and the students will then perform this clinical examination system wise, like clinical examination of cardiovascular system, clinical examination of respiratory system, clinical examination of nervous system, and so on. So this lab is situated on the 4th floor. Then we have a mammalian lab. Of course, nowadays there is a ban on experiments on animals. As you are aware, we cannot do any experiments, neither the students are supposed to do, nor can we demonstrate the animal experiments. So instead, we have videos, and these videos are played so that the student can get an idea about the mammalian experiments. And we have a research lab which is also located on the 4th floor, and this is equipped with many of the instruments which we shall talk about later on. Now, in addition to these labs, the department has 3 demonstration halls, each with a capacity of 75 students, which are used for demonstrations and also for small group teaching. They are equipped with the projectors, LCD projectors, overhead projectors, and the sound system. Departmental library, I have already mentioned, there is a departmental library just next to the research room, and there are more than 170 titles. Coming to the staff members of the department, we have 2 professors, we have 5 associate professors, 1 assistant professor, and 2 tutors. These are the teaching staff, and the department also has adequate number of technical and clerical staff. The recommended textbooks. Now, as soon as the physiology teaching starts, many of you come to us for the names of the textbooks. So this is a list of recommended textbooks in physiology. The most favored book will be the textbook of medical physiology by Guyton and Hall, the latest edition. Then textbook of physiology by A.K. Jain, again go for the latest edition. Comprehensive textbook of physiology by G.K. Paul, textbook of medical physiology by Chatterjee, Fundamentals of Medical Physiology by Prakasam Reddy, and there is a reference book, that is the Review of Medical Physiology by Gannon. So of these, you can purchase only one book. You can go through these books when you come to the department and find out which book is more suitable for you, and accordingly you can buy. Similarly, for practicals, we have textbooks of Practical Physiology by Ghai, A.K. Jain, and G.K. Paul. Again, you can go through these books and decide which is better for you. Right, about the journals or the record books as we call, and logbook, the student should purchase the physiology journals as well as the physiology logbooks from the consumer stores. So here itself, let me tell you about the discipline in the department. The student should wear aprons for all teaching activities. The mobiles should be either switched off or on the silent mode. They should bring journals for practicals. When they are coming for practicals, they should bring their journals and get them signed from the teachers before leaving the lab. And of course, the student should try to keep maximum distance between 2 students while doing practicals, and follow all those precautions as coming from government from time to time. We have some special instruments like the computerized autonomic function test analyzer, where we study the autonomic function test. Probably by this time you must have learned that there are 2 types of autonomic nervous system. One is the sympathetic system, the other is the parasympathetic system. So these parts of the autonomic nervous system, they can be studied, the functions can be studied by using this instrument. Then we have student physiographs, 2-channel physiographs and 4-channel polygraphs. We have computer-based spirometer, which is essential for the lung function test. We have instrument that records the galvanic skin resistance, which is also part of sympathetic activity. We have electrocardiograph machines which can record the ECG of the patient, and we also have cardiac autonomic neuropathy analyzer, that is the CANVIN, which is also part of autonomic function test. The major thrust areas of my department are the sports physiology. You know, this is one of the upcoming branches in the medicine also, and also in the sports. Then yoga, we want to stress and the changes occurring during yoga. Then electrophysiology, where the electrical events are recorded from different parts of the body, their interpretation and analysis. And an integrated sort of research with other departments depending upon the topics that are available. The physiology department also has postgraduate activities. The postgraduate students are given well-structured training by regularly holding PG activity in the form of journal clubs, departmental seminars and research work presentations, and practical training classes apart from the routine UG teaching activity, which is also allotted to the PG students. As a constituent of deemed university, we have a dedicated team of staff which is actively involved in the research work. The scope for the research in this basic subject of physiology is vast, especially in the field of neurophysiology, space physiology and geriatric physiology, which are coming recently. We are aware that one of the Nobel Prizes is awarded for research in physiology/medicine. So I think that is sufficient to stress the importance of physiology. Then there are the thrust areas of research which I already mentioned. The research work is being done and will continue to be done till the research is completed. All the faculty as well as the postgraduate students are involved in the research activity. A few words about the subject itself, that is the physiology. The word physiology is derived from two words, physis and nature. Physis is the interpretation of nature and logos is the study, and therefore we call this as a science of natural study. But actually in human physiology we say that it deals with the functions of the human body and tries to explain the changes occurring in the human body during health and disease. Remember, unless you know what is happening in the body, you cannot expect what changes are going to take place in the disease process. And therefore this is a basic science. The knowledge of human physiology is essential to understand various intricacies and complexities of the human body. The sound knowledge of physiology helps the students to correlate between the normal functioning of the human body and the changes occurring during diseases. In clinical practice, this helps to understand diagnosis and planning of the treatment, and the analytical skill that is developed by the students helps them to become skilled doctors. The key word in physiology is homeostasis. So everything that we talk about in physiology is homeostasis. It is a term used for maintenance of constancy of the internal environment, as you know. The internal environment or the milieu interior is the fluid surrounding the cell, which we call as the extracellular fluid, and its composition has to be regulated for optimum functioning of the cell. So all the body systems, whether it is the cardiovascular system, respiratory system, endocrine system, nervous system, etc., all of them work together to maintain the homeostasis. There are three types of homeostatic mechanisms, but let us not go into them, just I'll enumerate the negative feedback mechanisms, the positive feedback mechanisms, and the feed-forward mechanisms. Failure of homeostatic mechanism leads to disease. The future plans of the department: we want to have a well-equipped sports physiology lab. We want to organize a national level conference of physiology and pharmacology. We want to extend further the computer aided teaching in the clinical human physiology as well as hematology, and acquisition of new equipments for the research. Thank you.
Good morning to everybody. I am S. Good morning to everybody. I am S.N. Jangle, Professor and Head of Biochemistry. Wish to give an idea in brief about the functioning of the Department of Biochemistry. Department of Biochemistry is a part of Rural Medical College, and the college is guided by respected Dean Dr. Rajveer Bhalwar sir. The college is a constituent unit of Rural Medical College. The college is a constituent unit of Pravara Institute of Medical Sciences deemed to be university and progressing under the visionary leadership of Honorable Vice Chancellor Dr. Y.M. Jairaj sir, Honorable Chancellor Dr. Vijay Kelkar sir, and President Honorable Dr. Rajendra Vikhe Patil sir, to achieve greater heights of success in imparting quality medical healthcare services to the patients and quality education to the students. Beyond academic curriculum, to create conducive environment for making learning more exciting, especially for the newly admitted student, provision for orientation cum introduction program is introduced. In medical education, it has been acknowledged that a positive educational ambience contributes to the better quality of education. Various parameters are used to determine the educational ambience of an institution, which include students' perception of atmosphere, perception of learning, perception of teaching, social self-perception, and academic self-perception. The ambience of any educational institute is primarily responsible for imparting quality medical education which prepares the students in all spheres of learning and development. The satisfaction of students in terms of their learning outcome, teaching, living conditions, and social lifestyle determines the overall ambience of the institution. Though teaching, academic and clinical, and learning are the main pillars of any medical education, grooming a student to complete medical professional is also the duty of the institution. So far as the goals and objectives of biochemistry are concerned, they are like this: to make the students to understand the scientific basis of the life processes at molecular level, orient them towards the application of knowledge acquired in solving clinical problems, integrate various aspects of metabolism and their regulatory pathway. Deviation of this pathway results from normal diseases, and skill to develop for solving scientific and clinical problems and decision making. Core values of the departments are academic excellence, encourage the quest of lifelong learning, inculcate the global perspective in attitude, sensitivity to social responsibility, integration of human values, ethics, professional etiquettes with teaching, and value-based education and research-driven healthcare. These are some of the photographs of the campus. Infrastructure as per the National Medical Commission guidelines, there is a spacious laboratory with functional instruments. So far as the faculty is concerned, myself S.N. Jangle, Professor and Head of Biochemistry, I have acquired MSc Biochemistry degree from MS University of Baroda, PhD Biochemistry from Marathwada University, MSc Medical Biochemistry from Nagpur University, PhD in Medical Biochemistry from BJ Medical College, Pune, and PhD in Medical Biotechnology from Pravara Institute of Medical Sciences, deemed to be university. Dr. G.D. Dhokikar is Associate Professor. He has MD in Biochemistry and he has done his MD from GS Medical College, Mumbai. Dr. A.D. Shinde, who is also Associate Professor, he has acquired MD Biochemistry degree from Government Medical College, Nagpur. Dr. S.K. Kulkarni is Assistant Professor and he has done his MD course from SRTR Medical College, Ambezogai. Dr. Shruti Saraf, who is also Assistant Professor, acquired her MD Biochemistry degree from Raichur Medical College. K.N. Hotkar, Assistant Professor, his MSc degree he has acquired from Government Medical College, Solapur. Mr. Nagarkar is tutor, he has done his MSc from Ahmednagar College. Dr. P.S. Ancha, Dr. S.K. Kole and Dr. P.S. Alangare, all are tutors and they have acquired their MBBS degree from Pravara Institute of Medical Sciences, Loni. Faculty graduated from various universities and bringing unique academic culture to department, and each faculty member is proud of their alma mater. So far as the teachers and facilitators are concerned and their duties and work ethics, we have well qualified faculty as per the criteria of National Medical Council. There is a judicious blend of experience and enthusiasm. Faculty is available for the problem solving. Syllabus is covered as per the NMC guidelines and there is continuous internal assessment apart from mandatory without causing unnecessary stress to the students, and it is a competency based outcome is there. So far as the teaching learning methods are concerned, the faculty is involved in imparting teaching by utilizing various methodologies and techniques, which includes traditional one, blended one, ICT enabled, and having learner-centric approach, and also includes beyond curriculum scholarly activities. The methodology is didactic lectures, small group discussion, case-based scenarios, demonstrations, practical, DOAP, that is demonstrate, observation, assistance and performance. There is also clinical, early clinical exposure module, skill development and viva voce. 100% of the faculty utilize LCD projector for their presentation. PowerPoint presentation is included. There is video demonstration. Video lectures are carried out using live streaming on YouTube or Microsoft Teams or Google Meet. And various groups of students are made and they can ask their difficulties and the faculty is prompt to give explanation and guidance to solve their academic problems. So far as the strategies are concerned, various domains of learning are involved. For example, K, knowledge, S, skill, A, attitude, and C, communication to acquire various competencies. Where K is knows, knowledge, describe, KH, know how, which discuss and analyze. S, shows, it is a skill, attitude, attribute the ability to identify, and SH shows how, skill, to able and interpret. P is finally the performance, that is the mastery for the level of competency. The department has prepared teaching material as per the relevance and needs of the student. It is all student oriented. For example, specific learning objective for teaching, a booklet, then OSPI handbook, practical viva handbook, case studies handbook, then construction of biochemical investigation to confirm the provisional diagnosis, and a book on viva voce questions and answers in practical biochemistry. Apart from this, we are having PowerPoint presentations, learning resources in the form of question banks for paper 1 and 2, and copyright record book which you have to complete during your practical hours. Dr. Kulkarni has already explained you that you have to complete your practical on the same day, and after getting signed it, your attendance will be marked. Department of Biochemistry has also edited a booklet on value education for students. One of the other editor is Dr. R.R. Carle, who is professor and head of pathology. And this book is given gratis to every student. Extra practice tests are, apart from the mandatory tests, are conducted to improve the answer writing skills. Test examination for practice using multiple set of question papers. There is informal feedback from students and remedial course of action and responses. Generally, we conduct a mock viva prior to the preliminary examination, and we also participate in problem-based learning, which is an activity of rural medical college. E-learning facilities are also available. During the day-to-day theory classes, practical, continuous formative evaluation, faculty is in a position to differentiate between fast learners and slow learners. Marks obtained or the performance in the test is one of the indicators to differentiate between these two groups. For fast learner strategies, we encourage them to participate in case presentation, group discussion, seminars, to perform small research projects. Additional study material is supplied as and when they demand. Then they are also encouraged to utilize the ICT facilities, and opportunities are provided to them that challenge their cognitive and psychomotor domains. In simple words, higher goals are set up for them to achieve excellence. For slow learners, actually I do not like the word slow learners, so I have modified it. Those who have diverted their focus from the expected goals to be achieved temporarily are counseled case specifically, encouraged to ask difficulties and appropriate remedial actions are taken by way of doubt clearing sessions, conducting extra classes, arranging extra tests or practicals, and guiding them to overcome their problem. Counseling cell is also established and managed by qualified behavioral therapists to solve not only academic but also personal and social problems. Mentors are available 24 hours. These are some of the photographs. This is our spacious undergraduate having a capacity of 128 students. A student observing the color developed for a particular test. There is early clinical exposure, and a clinical biochemistry lab is also there. The clinical biochemistry laboratory utilizes the dry technology, thus saving about 3.5 lakhs liters of water per year. We also participate in external quality control program of Vellore, and the reported values are within 100 VIS, that is variance index score, a reasonable score, an excellent quality indicator. These are the photographs. In this you can see Dr. Shetty, chairman of NAC inspection committee, interacting with the student. Corridor of Biochemistry department. This is the wall of fame, where the students who have acquired their academic excellence, or in simple term distinction in biochemistry in first attempt, their names are put right from 1984 admitted batch till date, and the students who are very proudly seeing their names in the wall of fame. The outcome of program is achieved by course-based outcomes by imparting alignment and integration of various topics, learner-centered instructions, skill acquisition with ATCOM, self-directed learning, lifelong learner, leader, and member of healthcare team and system, which ultimately points to competency-based training program which stakeholders complete satisfactorily. The major source of gaining knowledge is library. Salient features of central library is air-cooled hall to study, multiple copies, especially recent editions of textbook and reference books, number of scientific periodicals for viewing recent publications and research papers, opaque system in library, Wi-Fi facilities, subscription for online resources, number of computers, and there is also a language library. Number of biochemistry books in central library are about 654, and number of biochemistry titles in departmental of biochemistry is 123. Apart from this, you can have online books PDF that is free download, and the useful links are like this. For referring the research articles, we have multiple websites which are freely available, or for some of which we have also subscribed. These are like this. which is DellNote, UGC Inflibrate, MUHS Digital Library, Medlar, PubMed Central, Biomed Central, Biotechnology Journal, Physio Journal, Medical Journal, WHO publication, MedNo publication, like this. Then EG Pathshala, CAC Digital Media Library, NPTEL, Swayam, which is a central government sponsored program, National Digital Library, DOAJ, Digital Library of India, and of course the Google Scholar. Now, we also have the collaboration of linkages for teaching, learning, research and extent of the college. These are not specific for biochemistry, but these are of college. We have collaboration with Harvey University of Jerusalem, Wayne State University of Detroit, Karolinska Institute of Sweden, Pioneer Medical Research Foundation, Michigan, USA, Linus Palme Scholarship Program, Sweden, Lund University, Sweden, Erasmus Mundus, Sweden, Jeevdaya Foundation, Texas, Euphrates, Erasmus Mundus for exchange of faculty and students for academic activity with specific objectives, Erasmus Mundus Program Action Plan to India to Europe, and University of El Bosque, Colombia to exchange faculty of students. Students who are interested can always take advantage of this facility which is provided by the college. So far as the Department of Biochemistry, along with other departments, is a part of mentor-mentee system. Yesterday, Dr. Mohan Pawar sir, Professor and Head of Forensic Medicine and Toxicology, had already elaborated on this topic, but in brief, I will say that the ratio of mentor to mentees is 1:10. Uniform single dietary format is introduced. Assistant professor, associate professor, and professors are actively involved in this mentorship program. Monthly meetings are held and its proceedings are documented. In this, shy students are encouraged to voice their problem. Academic, social, or health problems of students are discussed and appropriate remedial actions at departmental level or college level is initiated. Apart from this, in some serious cases, parents are also kept in loop to overcome the problem. Therapy involves counseling, management of behavioral changes, psychological encouragement, and some cases are referred further for medical treatment. In short, every effort is made for students to feel at home when they are away from home. Pravra Institute of Medical Sciences, deemed to be university, has established an innovation council. The main objective is to promote the innovation in medical, dental, physiotherapy and nursing students and faculties. Secondly, to help the student and faculties to smoothen the process of the innovation, copyright and patent filing. And the Innovation Council, along with Research Cell, help in implementing the innovative ideas. Students are encouraged to think out of box, seed innovative ideas, perform experiment, and scale-up facility can be made up for their startups. Finally, I can say that yes, we are proud to say the campus is ragging free. We expect and wish you all to graduate with flying colors. With all the best wishes from the Department of Biochemistry, and hope soon you will arrive in Rural Medical College to have physical classes where interaction will be more fruitful. Every details of the activities you will come to know when you will come to department. In this brief talk, everything in detail cannot be explained, but I hope I have made clear the core value, aims, objective, vision and mission of Biochemistry Department, the facilities available with us, and the overall pattern of examination was explained to you by Dr. Pakle, along with what is CBME, what is its impact, and what is expected by the National Medical Council from Indian medical graduate. Thank you.
दोन्ही एकदम नाही दिसणार ना. Good morning. I am Dr. Dongre, professor in pathology. Pathology is second year subject, not the first year subject. seen all the 3 subjects related to first year. So I am going to discuss about what is pathology. Aim of my talk is what is pathology, introduction to pathology, what is scope of pathology, pattern of study of disease, importance of pathology. So one by one we'll take. You must have heard the word pathology before. Pathology is, you must have learned in form of that various investigations are done by pathologists. But what is pathology? Pathos means suffering. Logos means study. So pathology means study of suffering is known as pathology. So you can understand that all diseases will be part of pathology. All diseases occurring in the world are part of pathology. So you can imagine the vastness of the subject. What is included? What is in the pathology? If you try to study each and every disease separately, it will be difficult to understand and remember both. So there are various common factors between various diseases that we can learn first, so that we have overall idea of that particular disease. So that type of pattern will be seen in many similar diseases. So once you understand one pattern, many diseases you can learn, and that we are going to discuss in general pathology. Systemic pathology, certain diseases are common to particular systems. What is systems? That some idea you have, and you will be having more idea when you learn anatomy and physiology. So basically all diseases are covered in these two, general pathology and systemic pathology. These diseases are learned by various mechanisms over the years, and there are mainly 2 mechanisms which were commonly used previously, that is clinical pathology and autopsy. These are 2 mechanisms by which disease process were learned. Other methods, clinical methods, were separated out from pathology, and only 2 still remain with pathology, and therefore clinical pathology and autopsy is also part of pathology. So general pathology and systemic pathology actually deals with pathology. Clinical pathology and autopsy is the mechanism by which we understand disease process, and by this mechanism only we try to understand what disease is occurring in the patient. So this is the scope of pathology: general pathology, systemic pathology, clinical pathology and autopsy. Rapidly we'll see what is included in that. General pathology: cell injury, inflammation, repair, circulatory disorders, genetic disorders, immunological disturbances, neoplasia. So these are the various patterns of disease which are common to many diseases. So once you understand these disease processes, you may understand many diseases. Certain diseases are specific for particular system. So these are hematology, cardiovascular system, respiratory system, gastrointestinal tract, liver, kidney, lymphoreticular system, male and female genital tract, breast, nervous system, bones and soft tissue, skin and adnexa. So these are the various types of systems under which we will be learning different diseases which are specific for that particular system. Amongst this, hematology, CVS, RS, GIT, liver and kidney are more important because they deal with non-neoplastic as well as neoplastic conditions. Others have non-neoplastic conditions, but in pathology we are not going to go in detail of that. you will be learning those in your clinical side. So mainly we'll be concentrating on the neoplastic conditions. Hematology, which includes RBC abnormalities, WBC abnormalities, hemorrhagic disorders and blood banking. Though blood banking is not abnormality, it is the normal process by which we decide how the blood should be given to another patient, from one donor to another patient, and it is normal process, but still it remains with pathology. Various investigative procedures by which we learn the pathology or we learn the disease process is actually part of pathology. Though clinical pathology should include all the types of tests which are carried out, like various investigation related to blood, may be biochemical, may be hematological. So that is part of clinical pathology. Then it may include also histopathology, it may include cytopathology, it may include microbiology. So a huge array of investigations are part of actually clinical pathology, and you can imagine the vastness of the subject. Over the years, by gradation, arbitrarily this clinical pathology has been divided into various subjects. Microbiology, you have a separate subject. So a separate subject you will be dealing with in microbiology. So it is over the years it has come out of the purview of clinical pathology. Biochemistry, clinical biochemistry, which was part of pathology initially, now has come separated out from pathology, and it is part of biochemistry which you are going to learn in first MBBS. First MBBS, anatomy, physiology and biochemistry. Biochemistry was previously part of physiology, was separated out because of vastness, and in that clinical biochemistry also was included. So from clinical pathology, clinical biochemistry has come out of the purview. Histopathology and cytopathology we consider a separate entity. We will be dealing it in separate manner. So it has also come out of the purview of clinical pathology. And hematology, also a vast subject, so it is a different section, not a different subject at present, but a different section. So what is included now in clinical pathology is urine examination, stool examination and fluid examination, that is ascitic, peritoneal, pericardial, CSF and seminal. So these are the basic investigations which are now in the purview of clinical pathology. Laboratory findings in diseases, that is mainly biochemical disease test, but still we will be dealing with it in pathology. That is myocardial infarction, various enzymes, various function tests, liver function tests and kidney function tests you are going to learn in biochemistry, but also you are going to learn in pathology. Hematology has come out as a separate section in pathology. Histopathology is also separate section. Autopsy, but you must have heard post-mortem. There are two ways in autopsy can be done, is to identify the disease process that is carried out by pathologists. Discussing various disease processes like introduction, etiology, pathogenesis, morphology, clinical findings, age group, and therefore we say that though age is not specific cause, for example, in case of acute lymphoid leukemia, it occurs in children. Acute myeloid leukemia occurs in slightly younger age group. Chronic myeloid leukemia occurs between 30 to 50 years of age, and above 50 years of age, chronic lymphocytic leukemia occurs. So there is difference in the pattern of disease in particular age group. So age is considered collaborative cause. Sex, again specific sex, is not a specific cause, but certain diseases are more common in males or certain diseases are more common in females. So that sex is considered as a collaborative cause. Environmental factors. Various diseases may occur because of environment. Certain diseases are more common in particular geographical areas. Melanomas are more common in New Zealand because sunbathing is common over there, so melanoma occurs over there. So these are even environmental factors which may cause disease process. They may not be a specific cause, but they are enhancing the chance of occurrence. Genetic factors. Certain genetic alteration may make the patient susceptible for particular disease, and therefore genetic factors may be considered collaborative cause. Genetic factors may be specific cause also. Sickle cell anemia may occur because of certain specific alteration in the genome. So genetic factors may be specific cause, may be collaborative cause. Psychological factors. Just because of psychology, physical alteration will not occur. But psychology helps in physical alteration because of various mechanisms. Hyperacidity occurs because of psychological factors, and that may lead to other diseases process. So it is a collaborative factor, not specific factor. So these are various collaborative causes which may cause disease process. Pathogenesis. Mechanism by which causes brings about structural and functional changes are known as pathogenesis. I'll come back to this. Morphology. Structural alteration in cells or tissue that can be observed macroscopically or microscopically. Macroscopically means with naked eyes. Microscopically means with the help of microscope. Are known as morphological characters of disease. Sights, gross and microscopy are the subheadings under which we'll be learning that. Here you can understand there is alteration in the cells or tissues, and the normal appearance of cells and tissues you are going to learn in anatomy. Just now you might have learned about it, or in detail you will be learning in short while. So alteration in anatomy is going to lead morphology of disease process. Clinical findings. Clinical findings are functional consequences of structural alterations are known as clinical findings of the disease. Various functions you are going to learn in physiology. In physiology, you are going to see various functions of various organs. Any structural alteration means anatomical alteration is going to lead to functional alteration also, and those functional alterations we are going to see in the form of clinical findings. Clinical findings we see in the form of symptoms, signs and laboratory findings. Symptoms means what patient complains, sign means what clinician elicit, and laboratory findings that in pathology what we see the various investigative procedure, what are the alterations, then normal. So functional consequences of structural alteration are known as clinical findings of the disease. So morphology means alteration in anatomy, clinical findings means alteration in physiology. So I've come back to pathogenesis. Mechanism by which causes brings about structural and functional changes are known as pathogenesis. So starting point is various etiological factors. How they bring about structural and functional changes. Structural means morphological changes, means alteration in anatomy, and functional changes means alteration in physiology. So basically pathology means what changes has occurred in anatomy and physiology. Complication, sequelae and fate. Further progress of the lesion both morphologically or clinically is known as complication. further progress of the lesion both morphologically or clinically. If clinical progress is there, then it is called sequelae. I have said that thrombus causes myocardial infarction. So sequelae of thrombus is clinical progress, that is myocardial infarction. And fate means morphological progress, means what happens to that thrombus is morphological progress. It may reduce in size, it may increase in size, like that. So it is fate of that thrombus. So further progress of lesion both morphologically and clinically is known as complication. It is part of sequelae means clinical progress and fate means morphological progress. Prognosis word you must have heard beforehand. It means what happens to what is outcome. But here we see the chance of mortality at given situation. What is going to happen to patient, whether he is going to die or not. So chance of mortality. Mortality means chance of dying, death. You are not going to go in detail of whether patient is going to die if patient is suffering from acute appendicitis. So this chance of mortality is important where we are not sure what is going to happen, and that is important in neoplastic condition. Various types of tumors, we'll be discussing neoplasia in detail later on. So neoplasia is in that only prognosis will be important. In other conditions prognosis will not be important. So introduction, etiology, pathogenesis, morphology, clinical findings, complication are important in understanding various diseases. Prognosis will be important in neoplastic condition. So we have seen introduction, then scope of pathology and what is pathology. You can understand now the importance of pathology. It makes basis for medicine. Once you understand various disease processes, you can apply this knowledge in various clinical fields, medicine, surgery, gynec, etc., where you can see what changes can occur and how to treat them. Means diagnostic part will be base will be made by pathology. So understanding a disease process occurring in a particular patient, you should be knowing pathology beforehand, then it will be easier for you, and that is the importance of pathology on clinical side. Unless you understand anatomy, physiology properly, you are not going to understand pathology properly, because pathology is nothing but alteration in anatomy and physiology. So you must understand anatomy and physiology in first year, and that is going to help you to understand pathology in better way. To make you understand what importance of pathology again, I would like to share with you a story. A giant ship engine failed. The ship's owner tried one expert after another, but none of them could figure how to fix the engine. Then they brought in an old man who had been fixing ships since he was a young. But none of them could figure how to fix the engine. He carried a large bag of tools with him, and when he arrived, he immediately went to work. He inspected the engine very carefully, top to bottom. Two of the ship's owners were there, watching this man, hoping he would know what to do. After looking things over, the old man reached into his bag, pulled out a small hammer. He gently tapped something. Instantly the engine lurched into life. He carefully put his hammer away. The engine was fixed. A week later, owners received a bill from the old man for $10,000. What the owners explained, he hardly did anything. So they wrote the old man a note saying, please send us an itemized bill. The man sent a bill that read, tapping with hammer $2, knowing where to tap $9,998. So effort is important, but knowing where to make an effort makes all the difference. So effort in pathology is going to make all the difference, as pathology is going to teach you disease processes which you can apply to identify disease in a patient. So best wishes for your long journey ahead in MBBS. Thank you.
छान झालं सर. ही स्टोरी मला खूप आवडली शेवटची.
Is a video come PPT presentation from Department of Microbiology from Dr. S.M. Jain. I welcome video come all the first year students from this Department of Microbiology orientation class. Dr. This is for microbiology, and I welcome all the lucky and luminous stars selected out of many who got an opportunity to learn the highly honored knowledge of science and art of medicine. Luminous stars, after completion of this, you will got an opportunity even without learn the highly honored knowledge of science and art of medicine. Luminous stars. Good morning, all newcomers to this college. I am Dr. S.M. Jain, Professor in Microbiology. I welcome you all. Dear students in this for microbiology, and I am welcoming all the lucky and luminous stars selected out of many who got an opportunity to learn the highly honored knowledge of science and art of medicine. In this, after completion of this, and you will be doctors even without the bachelor's degree. Stars selected out of many who got an opportunity. Good morning, all newcomers to this college. I am Dr. S.M. Jain, Professor in Microbiology. I welcome you all to the college and the Department of Microbiology. I will show you briefly some of the microbiology key things and the department. I welcome you all lucky stars. To the college and the Department of Microbiology. Total 14 subjects, I will show you briefly in this 4.5 year course. Microbiology will be taught to you in second year MBBS. I welcome you all for 12 months. Lucky stars. You will have 70 hours of theory out of and total 110 hours of practical. That includes small group discussions and other modes of the teaching. You will have to take 3 internal and 1 university examination during this 1 year. 70 hours of theory by the doctor and in the hospital. The art of medicine is practiced, and in the art of medicine, the diseases are diagnosed, treated, and prevented. They are diagnosed by laboratory and radiology, and the laboratory has 3 wings, namely biochemistry, pathology, and microbiology. And very conveniently, diseases can be classified into microbial and non-microbial origin. I am just trying to zoom in to the microbiology, the place of microbiology into the whole medicine. So, very large number of the diseases are of microbial origin. Count the total number of disease incidences. I am just trying the total number of infectious diseases or the microbial diseases are much more than all other diseases together. And this microbiology is counted as a paramedical subject because it helps in the diagnosis and prevention of infections. I am just the increased incidence of infection in patients admitted to the hospital has another problem which has also to be taken care. Now, this is the brief of the things which you will do in the microbiology. You will be taught and you will learn existence of very tiny people, that is viruses, bacteria, parasites and fungi around us. Their names, their role in health and disease, methods to handle them, methods to detect their presence in the patients, prevention, etc. And then, of course, our own police and this amateur photographers video record. Now I'll give you a brief video tour to the Department of Microbiology. This amateur photographers very well video aware record by now that mainly 4 buildings are there in the college. I'll give 2 hospital buildings and 2 college buildings. One is old college building and another is new college building. By now, I'll take you one by one to briefly through these buildings and to the department. This is the old college building, the porch entry. This is connected to the new college building, which is a L-shaped 7-story building. This is the western front of the building. So Biochemistry department is housed. I'm sorry, this is second floor. Second floor Biochemistry department is housed, and the first floor and part of the second floor is allotted to pathology. Now we are climbing stairs for the third floor for microbiology department. This is Department of Microbiology, the L-shaped building, L-shaped floor, and this is the north-south wing, and this one is east-west wing. This is the faculty list of the microbiology staff. Right now we are 9 faculties. First we will go to the north-south wing from the central staircases. This is the first room. We have got a store. Then we have got departmental library and seminar hall. This is the research laboratory. Inside you can see equipments harbored for the research work for the PG and staff. There are 3 demonstration rooms of 80 students capacity. Beginning of the floor towards the southern side, in this wing there are staff sitting rooms here. Professors, HOD, other members are sitting here. This is demonstration hall with the 80 sitting capacity, and soon you will be familiar to these demonstration halls when you come in the class in your physiology and biochemistry departments who are housed in this college building only. This is the gallery opening to the western side of the campus. Another gallery is opening towards the southern side of the floor. This is the research laboratory. We will see few of the equipments. These are the equipments harbored in this room. This is for the research done by the PGs and the staff. Then on the east-west wing, these are the notice boards, and then this is the practical hall. This practical hall is big enough to accommodate 100 students. Then the next is the museum, in which there are many charts of the viruses. This is the rhabdo virus with the description and the diagrams. Other charts, and this is the charts and model. This corner is classical, used, a very common instrument in the hospitals and the laboratories, autoclave. So this is a brief view of the Museum of the Microbiology. Now I am going in the east-west wing towards the eastern side, and here side mostly the service laboratories are housed, and recently added molecular biology lab is also added, which is doing the corona RT-PCR tests. This is the molecular lab additionally housed, and this is already molecular tuberculosis laboratory being done. I'll show you the inside of this side later on. First we will see the bacteriology laboratory. This is a restricted area, so biohazards are there, so the signs of the biohazard are there. This is our bacteriology area, and this room is a well ventilated, along with the air conditioning and the air purification methods. You can see various Petri plates inoculated and ready for reading. These Petri plates are containing the organisms grown from the samples of the patients. You can see our technician is doing the bacteriology work. She will pick up the colonies from this plate. You can see the small colonies growing in this McConkey agar. She is ready with the loop to pick up the colonies, for which she will be doing further analysis. She is doing microscopy of the samples, where on the slide the sample is taken, they are stained, and then they are examined so that we can identify the organism. Side of the department is service laboratories. We have got 7 service laboratories. The special bacteriology, the autoclaving and media room. These are the rapid analysis machines, where the cultures and the other rapid bacteriological tests can be done. Here some of the very precious samples are cultured, like blood. You can see the blood bottles, blood culture bottles. These bottles are specially meant to collect the blood sample. This is molecular tuberculosis laboratory, where cartridge-based tuberculosis diagnosis is done very rapidly. Otherwise, tuberculosis takes long time in the diagnosis, and this is a relatively modern method of the molecular diagnosis of the tuberculosis. This is our media room. These are various ready-made media powders from which we make the media, and this is a cabinet in which the media is poured so that aseptically it is prepared. These are weighing areas. Newly prepared media is kept here. Better in this room we are having autoclaves, and where the autoclaving for the purification and the sterilization of the media is done, along with the washing of the used plates and discarding material to be autoclaved. This side of the laboratory is the RT-PCR laboratory. You can see various instruments. This is the biosafety hood. This is where DNA or RNA is to be extracted. Then here is the mixing is done. This is master mix room. Another hood for the biosafety, the working platform, biosafety cabinets where the RT-PCR work is done. This is the RNA extraction area. All the machines and all the system are in place. You need to wear a personal protective equipment. Look at this thing. She is reading something with inside the room with the personal protective equipment. You need all these kinds of equipment in the molecular laboratory where the DNA and RNA is done. Now I'll give you a brief tour of the Central Clinical Laboratory Microbiology section, which is present on the first floor of the building. This is the OPD building. We are entering into the OPD building. This is the OPD reception area. This is OPD building corridor. Now I am climbing to the first floor through the ramp. This is CCL reception, waiting and cash. And here there is a sample reception area. The counter for receiving the samples is there. Entry of the main laboratory. You can see from the beginning the microbiology department is in the front. On the left side there are pathology and biochemistry department, and on the right side it is connected to the sample receiving area where the phlebotomy is done. This is the sample receiving window of the microbiology department. This is the microbiology section of the Central Clinical Laboratory, where samples are received on OPD basis, and serology, whatever tests are to be done, are done here. You can see the samples received in the night. This laboratory is working throughout the night. The discarded samples, the incubators and the hot air oven. This is the auto analyzer room where a big chemiluminescence assay machine is housed. This is the microscopy reporting room. Here the samples which are reported by microscopy alone, they are seen and reported. This is the microscopy area. These are the instruments housed in the various sections of the Central Clinical Laboratory. These are various investigations performed in the microbiology. These are the certifications and the list of investigations done in other sections, that is pathology and biochemistry of the CCL. Just for your information, left side there is a housing of the pathology and biochemistry. You can see pathology. Here you can see biochemistry. Here in Central Clinical Laboratory, we are receiving the samples directly from the hospital with the help of the pneumatic chute. You can see 4 channels of the vacuum pump coming to the Central Clinical Laboratory receiving room, and you can so constantly two people are operating, receiving and sending the samples and the reports. So that was a brief tour to the CCL microbiology. Welcome to this college once again, and thank you all. Namaste.
क्लोज झालं का बेंटो
आता दिसते बस साईड आली सरांची.
हां ठीक आहे ठीक आहे हां तुमचं ते थोडं वेळ घेता.
As I said, my department provides academic services, that the subject will be taught. Medico-legal services also offered by my department, and research related guidance will be provided for UG, PG and PhD students. So what medico-legal services means? So wherein the legal components in the medical cases is involved, those cases are called as medico-legal services. Post-mortem examination will be done by the experts of our department. We are also assisting the clinicians in the examination of such MLCs. The inspection of the scene of crime, that is where the scene actually is confirmed, where the crime has occurred, that can be visited on the request of the investigating officer, and the helpful information will be provided to the investigating officer. This is another service which will be offered, and the medical legal cases whatever has been attended by our experts, they will be summoned in a court of law, and wherein they will depose their evidence. Accordingly, they will be working as an expert witness whenever being called in a court of law. So likewise, these medical legal services are offered by our department. Here is a medical legal post-mortem center. The autopsy is done at these places. We have got very well equipped, very well spacious mortuary in the premises of our institute only. So here it is the autopsy room where the postmortems are conducted, and which is attached with the cold storage where the dead bodies are kept either prior to the autopsy or after the autopsy on the request of the relatives. Student waiting hall is also there, so that the student can come and wait to attend the autopsies. Then we have got a storeroom, doctor's room, attendance room, and this inquest room is meant for the police officers. So police officers will be doing the detailed paperwork which is called as inquest, wherein they have to write all the details about the dead body, and that is called as inquest panchanama. Inquest, which is nothing but a panchanama in our lay language. So inquest will be made in presence of some panchas or the relatives. The details of the dead body will be noted down, and accordingly the paperwork will be made, and in addition to that inquest, requisition will be submitted to the autopsy surgeon so as to proceed for the medical legal examination. So this architecture of the autopsy room has got all those features. The student will also be taken to the autopsy room to demonstrate the autopsies, and accordingly we are offering the technical knowledge. See, likewise the student will attend the medical legal autopsy, and those will be demonstrated to the students. We also has got a facility of audio visual demonstration, live demonstration facility in autopsy room, wherein the cameras will be helping to display it not in the mortuary itself, but it will be displayed at other place, and which is very adjacent to the mortuary itself, in the to the autopsy room itself, in the mortuary premises. And actually this facility proved to be a boon during this COVID pandemic, and we are, instead of taking the students to the hardship of this COVID, to avoid the exposure to the students, and as the SOPs were laid down by our institute, by our department, we are avoiding the crowd in the autopsy room. Only autopsy surgeon and the attender will be there in any of the cases, and to avoid this crowd we have got the facility, as I shown you, wherein the actual autopsy procedure will be shown in the another place, and the student will even ask the questions. They have got a two-way communication sound mic system there, so the autopsy surgeon will be explaining and the student on the other side will be answering if any questions is put, or even the student will raise their doubts and the autopsy surgeon on the other side will explain the things. So likewise, this live demonstration facility became a boon during this hardship of COVID pandemic, and we, even though it has not become any hurdle, and we crossed it to show our students the autopsies of various kinds. Because the virtuopsy is coming technology, wherein without actually dissecting the body, because of the radio imaging technologies, the conclusion about internal pathology, injuries, to reach to the cause of death is the new technology called as virtuopsy is to be practiced. We have got a very expertised and experienced faculties with us. Myself, Dr. Mohan Pawar. We also have got Farooqi sir, who is a professor. Dr. Bukhtar sir is there as an associate professor. Sorry for the printing mistake here. The tutor, Dr. Patil, is working very hard here. So we have got these autopsy surgeons with us, the academicians. The learning material resources are ample in number, has good quality, and they are very well displayed in the museum. These are the museum specimens which actually are retrieved for the purpose of students learning, and those are very unique kind of specimens we are having. Also, we have got osteological specimens which differentiate the male and female, and the age-wise different features will be very well shown. The photograph will be depicting you the actual injury scenario, the morphological things, and various kind of deaths. Those will be very well depicted with the photographs. Because our subject is related with the injury and its weapon responsible, the weapons will also be shown, and it will be dealt in details. We have got good number of x-rays, radiological images are displayed in the museum. The another part of the subject is the toxicology, and the poisons, maybe whether it is a chemical one or the plant sources or the animal sources, are very well displayed along with its photographs, along with its literature there, so that the students can visit the museum at any time, can learn on their own. We are there to guide them, but still whenever they will get a time they can visit, so that the museum will be helping them out. The overall learning resources are very much useful. The skeletals of a child, the adult, teenager are also displayed. So the models are there depicting the injuries, the various kind of features on the healing of injury, the kind of injuries, it will be displayed well. We also encourage the students to learn more about the various kind of weapon. So they are also being taken to the nearest police station to know about the firearm weapons, various guns, the machine guns, the rifles, the pistols, revolvers. They should know, because the patient may come with any of the injuries, including the injuries due to firearm weapon. At the basic level, they should know the kinds of forensic ballistic, that is kind of weapons there, how the injury will be caused, and how they should proceed with the management that will be dealt. So we are encouraging our students to attend the visits to the police station. The faculty will be accompanied and they will be shown the various kind of features there. And yesterday itself you might have witnessed, on the 26th itself, the 2018 batch has presented a unique kind of activity, that to online, for the first time in the history of forensic medicine, not only in Maharashtra but in India, and even I am sure in the world itself. It is nothing but a moot court. So see, our department, the institute, is working since last 5 years on this project, on this academic activity, and we have got a very talented students with us. They are working hard and they accordingly present their talent with the guidance of the management, with the guidance of the department. The moot court trials are there, taken place. These are nothing but the court proceedings protocol, which will be shown in a role play manner, and every year the different case will be taken, so that the medical entity will also be conveyed through those activities, and they can learn not only by didactical means but this kind of role play methodology. So we are also encouraging our students to go through the moot court trials to learn the things through this thing. Our subject is actually all about application of our medical knowledge in the administration of justice, and accordingly our all efforts will be providing as much as information for the administration of justice. Police will be approaching, the magistrate will be approaching us, and accordingly we are helping them out. Another part is also there is a medical jurisprudence, wherein the doctor should know the law of the lands, and here the application of various laws in their own medical practice will also be dealt. And toxicology, as I said, the poisons, their nature, their appearance, their availability, their effects, the reasons for the consequences or complications, the treatment, and any death if it is occurring, what features will be there. So everything will be dealt about the poison under the toxicology heading. So our forensic medicine has got the teaching hours of 125 hours, including theory and practicals. It will be taught in second year and third year, that is phase 2 and 3, and accordingly exam pattern will have total 200 marks, one theory paper 100 mark and 100 marks for the practicals. In the theory we have got 20 marks MCQs, SQs of 28 marks, structured long answer questions are there of 52 marks. The practical will be of 75 marks with Viva 25. Internal assessment examination will also be held, but 40% individual passing is must, combinedly 50% passing is necessary. The journal will also carry 10 marks, and this internal assessment examination will be held in the first, second, third internal and preliminary. Total 4 examination will be held, and accordingly the total mark will be 250. How? See, the 4 examinations, first internal here, second internal, third internal, preliminary. So first, second, third will be of 50 marks, both theory and practical, but the prelim will be of 100 marks, and accordingly total will be 250 marks each. And then it will be converted out of 40 by dividing it with the marks obtained with 6.25, and accordingly this minimum 16 marks are necessary to qualify for university examination. Our subject, as I said, will be for the second professional, and it will be dealt with pathomicropharmacology, and which will be having their university examination in the third professional part 1. So over almost 2 years the subject will be dealt and has got a 125 teaching hours. In second professional, total 50 teaching hours are there, which includes 15 lectures, 5 hours self-directed learning, and small group or tutorials or integrated teaching practicals of 30 hours will be dealt in the second professional itself, as I displayed it earlier. In the third professional, that is phase 3, the total 75 hours are there, out of which 25 hours will be for didactic lectures, self-directed learning will be taken with 5 hours, and again 45 good number of hours for actual activities like small group, tutorials, integrated teachings, and including practicals. So here are its description for the third professional. So likewise, our subject will be covering the first part in the second professional and second part in the third professional for almost 2 years. So we recommend you to go through these books. These are the books recommended: the Narayan Reddy, the Modis, JP Modis, Apurbanandas, Sharmas, Pillais, the Parikhs, the Gautam Bishwas, Nageshwar Rao, Rajesh Bardali's book. So these books, in addition to have some foreign authors reference books also, that can also be seen or referred for the additional knowledge. So these are the various kind of reference books we are having, and with this I hope that the subject is being introduced in a short time with all its details, and we are eager to receive you in the second professional immediately after passing your first MBBS examination. So please have a look what different subjects, what different departments will be there in the medical college, so that you can have the idea when you are going to attend it. So with this small introduction, again I congratulate each of you and welcome you to the your professional career. Thanking you so much.
म्हणून थांबावं